Healthcare is expensive. Let's just get it out there. It costs a lot and we all know it. I have 5 kids myself, and even being a doctor, we're still spending a lot on our healthcare. You can't get away from all the costs, but there are some simple things that you can do. So in this video, I'm going to review 5 easy things that you and your family can do that could end up saving you a lot of money. Welcome to Family Med, your medical home for practical and accurate information to help your family make healthy decisions. If you're new here, let me introduce myself. I'm Dr. Eric Richardson, and my passion is helping you cut through all the healthcare information clutter on the internet. If that sounds like the kind of information you or your family need, make sure you follow along with us. Hit that subscribe button and share it with your friends. So today, I've decided to help all of you save a few pennies. The economy may be doing better, but that doesn't mean that we all have a ton of extra cash to be throwing around. For some reason, healthcare is one of those areas that everybody really hates to spend money. It's kind of like buying tires or a new refrigerator. You have to do it, but it's really not much fun. Now, we can't get away from every cost in healthcare, but there are some simple things that each one of us can do to minimize and cut costs where it doesn't really matter. So let's talk about them. The first way that I recommend cutting costs to my patients is to get tests done at an independent lab or imaging center. Your costs can be dramatically less. Oftentimes, you can get them for 50 to 75% of the cost that you can get at the local hospital. I'll give you a personal example that happened to me recently. My son, he had some issues with some pain in his shins. He's a runner, and we needed to do an evaluation for any evidence of stress fractures. Well, I was a little lazy and in a hurry, so I just sent him downstairs to the hospital to get it done instead of at a local independent facility. I have a high deductible insurance plan, so to my surprise, when I got the bill, it was $300 just for the x-ray, and then another $35 for the radiologist to read it. If I had sent him to the local outpatient imaging center, it would have been $55, including the radiology read. So you'd think that I would follow my own advice. If I had, I would have saved me a lot. Now the same holds true for getting lab work done. Look for an independent lab to get the best price. Just ask your doctor to print out the lab slip or the imaging order, or even better, ask them to send it to a local independent facility. The second area that I recommend to save money is on your prescription medications. If you don't have insurance, or if you're on a high deductible plan like me, you're typically left responsible for the entire amount of the medication. This can add up pretty quickly. One of the first things that I recommend doing is looking into a prescription savings card. Now, just a disclaimer here, I have no affiliation with these people, nor am I being compensated for anything for this. But one that I recommend a lot to my patients is the GoodRx card. It's really a good way to comparison shop. You just put the medication in you're looking for, and they search all the pharmacies around you and show you where the best price is. You click on that pharmacy, and they'll give you a coupon that you can use at the pharmacy to get it for that price. Now, they also have an app for your phone, and it really works the same way. It's really convenient and has helped us get some better prices on medications. But it also highlights a significant difference in medication prices that you can find between pharmacies. Oftentimes you can use this then to negotiate a price at your personal pharmacy if you don't want to go to a different one. Now, this isn't insurance, and it doesn't go through your insurance companies either, so you're going to pay cash for it. But oftentimes, it really has beat what I would have paid using my own insurance program. There are several similar programs out there, so check it out. This really does, though, tend to work better for generic medications. Now, if you've got a name brand medication, make sure you go to the manufacturer and get a coupon for the prescription you are on, and really that can help you save you a lot of money as well. There's certainly a lot of different things out there that can help you save in your prescription costs. Now, I'm not going to go through all of them in this video, but if you have something that's working for you, let us know here in the comments below. A third way, and one of the biggest ways to unexpectedly rack up a big medical bill, is to go somewhere out of your insurance network. It doesn't happen as much when you're seeing your primary doctor, because that's something likely you've researched. Where I've seen patients get burned is when they go get labs or imaging, or they see a specialist that I've referred them to. As a physician, I'm not going to know who is or isn't in your network, as there are so many different insurance plans. So as much as I try to send you somewhere that takes your insurance, I can't guarantee that I'm going to know. Where this may come back and bite you, that you wouldn't even know is when you'll go and need the services of something like a pathologist after getting a biopsy or even a pap smear. You have no visibility on where the doctor is going to send that specimen. If they send it to an out-of-network pathologist, then you can get stuck with a bill that you were not expecting. Now, ask their doctor where they send their specimens before having it done, and make sure they're a preferred provider. So always remember, check with your insurance carrier before getting any kind of care to make sure that they're in your network. It's going to save you a lot of money. A fourth way that you can save a lot of money is in getting care after hours. This may seem obvious, but it can result in significant savings. When you need to see your doctor after normal clinical hours, try and go to an urgent care center instead of going to the emergency room. This can result in thousands of dollars in savings. Now, the purpose of this video is not to tell you when it is appropriate or not to go to the ER. I don't know your situation. What I am going to say though is that much of the time, that what goes to the ER can easily be handled in an urgent care setting. In fact, a recent analysis showed that 71% of the visits to an emergency room were unnecessary and could have been cared for in an urgent care or even the next day at your doctor's office. Now, I'm not talking about your heart attacks or your respiratory distress. I'm talking about the late night visits for a cold or earache symptoms that tend to plug up the emergency room. If you wonder where the most appropriate to go in your situation, call your doctor's office. There's always somebody on call that can help guide your decision. A lot of the time, things can wait until the next day, so take advantage of whoever is on call and get their advice on the best place to go. If you don't have a doctor, get one. If you still don't have one, then even a lot of insurance companies have a nurse triage line that you can call and get advice as well. Going to the ER instead of an urgent care for an unnecessary visit can cost you thousands of dollars more that you just didn't need to spend. Okay, last but not least is a fifth way that I recommend saving money on your health care. Now this one may seem a little more self-serving, but bear with me. The last way I'm going to recommend that you save money on health care is get yourself a primary care doctor. Now, how does seeing a doctor help me save money on health care, you may ask? Well, I'll tell you. First of all, in my specialty of family medicine, we're trained to focus on prevention. Prevention through healthy eating, activity levels, cancer prevention, diabetes prevention, and so on. Having a visit with your family doctor once a year and making sure your preventative care is in order is time and money very well spent. It's certainly easier to pay for a physical than it is for a lengthy cancer treatment that could have been prevented. Also, family medicine or primary care doctors are trained in the breadth of medical specialties. For certain, I'm not a neurologist or a surgeon, but we do treat most conditions and can best tell when it's important that you see a specialist or when it's not likely to be necessary. Specialists are more expensive and their tests are more expensive. When you see a specialist first, you're more likely to get testing that is a lot more expensive and maybe unnecessary to begin with. We're trained at looking at the whole person and getting a better picture of what's going on in your health. And lastly, there's a great benefit in having a relationship with your own doctor. Quick care clinics can be convenient, but you're also more likely to get unnecessary studies, be inappropriately treated with antibiotics, or other unnecessary treatments. When you have your own doctor that knows you, you will also get better care, and in the long run, that will save you money. Well, those are the tips that I have to share today. If you missed anything, go back and rewatch this video, or check out the note section below and review all that we talked about today. So hopefully you found these tips to be helpful. If so, don't forget to like, subscribe, and even hit that notification button, as well as share it with your friends. This really is key to helping me to be able to continue to produce this kind of content for you. Also, let me know what you think in the comments below. What ways have you found that can help you to save money in your health care? We look forward to hearing from you. Well, that's all I have for now, so until next time, this is Family Med with Dr. Eric Richardson. And remember, don't forget to take care of your body, because it's the only one you have.